Okay, so we are calling this meeting to order at 6:02. It is considered fully remote and it is utilizing all electronics in pursuant with all of our current statutes and will be made available on the town's website pursuant with all state laws. Um, we have Amy Lahaney here. We have Lax here. We have Barbara, Michael Herlihy, and myself, Chris Thornley. Um, our public participation, which we have none. Our third item is going to be to approve the minutes from our last meeting, which was June the 14th, which I have read and seem to be in cahoots with. So I will go ahead and motion to approve said minutes from the last meeting.
I can second that.
Okay. And well, Lex wasn't there, so he really shouldn't be voting on this. I guess you're it, Amy.
I vote yes.
Seeing as though you wrote it, I would hope so. Motion carried unanimously. Okay, so I will now turn the meeting over to Amy for our Director of Health's discussion items, starting with D1 and continuing on. Go ahead.
Right. So the environmental health report, we were a bit slow over the summer with our septics, not totally unusual. But now they have definitely picked up again, and so we are definitely busier and back to normal. We are completely caught up with our cosmetology, our pool inspections, and our restaurant inspections, which is fabulous. We are now at a place where we have we can maintain the number of inspections that need to be done because we've spread them out in such a way that it's easier to maintain all the inspections that are required. Some of the other things we've been doing is our child vaccine program has started again. So we got a new refrigerator and freezer for our vaccines. We're very excited for that. And we're starting to give out free vaccinations to children who need them to catch up for school entry and school requirements. We also got about 50 COVID test kits for free from the state. So we posted on our social media that we were giving those away. So those actually went pretty quick. We have maybe 15 left right now. We are working with the senior center to do a flu clinic with the Trumbull Health Department for seniors over on October 19th. So that's going on. And then we continue to publish different social media messages and different things that we're doing on our Facebook page. And then for our revenue report, it's really still early in the fiscal year. So I'm not seeing any big issues right now, and we're kind of tracking along where we should be.
Yeah, it looks like after I kind of reviewed it with the salons and food service, our normal licensing stuff, we actually were, slightly over, which is really nice. Looks like construction slowed down considerably with the septic stuff, permits and the B100s and so forth. They all seem to be lagging a little bit.
Yeah, the end of the fiscal year last year was definitely very slow for that. And it comes in waves. It just kind of depends on what's going on, the weather, the economy, and then where projects are in their approval processes.
Okay, continue on.
So that is the Director of Health discussion items. I did them really quick, sorry.
So caught up on that. Oh, okay. Yeah, you ripped right through them pretty quick.
Yep. I talk fast, Barbara can tell you.
Okay. All right. We talked a little bit about the revenue. That all seemed pretty in line. Okay. Was there anything else unfinished wise that we needed to talk about?
So the only thing I saw unfinished wise was from our last meeting was about the ordinances, the
Uh-huh.
personal service ordinances. And after talking to Ken and where it was and the last time you had worked on it and kind of evaluating what our needs are now, I don't really foresee an issue where we need to change our ordinances right now or add a tattoo ordinance. So as of now, I would just recommend that we stay where we are with our ordinances and then maybe relook at it again next year to see if things have changed in the course of the year.
Okay. All right. Anybody have any issue with that for any reason?
No, it's fine by me. I mean, they're all bloodborne pathogen certified, right?
Yeah, they have to be certified by the state. So they have to take a bunch of different things and keep records and everything else. So the person themselves are already licensed. And the two tattoo places we have in town right now have both been super great with talking to me and meeting with me and you know, asking for opinions and what their practices are. And so I really don't foresee a problem because the tattoo person themselves are licensed. So the license of the facility doesn't seem to be something we really need to do.
Okay. Any input, Lax?
Not really, because it's the first meeting I've been to, honestly, I'm the second one.
Yeah.
So, yeah.
Yeah, no, we had worked on this quite a while ago.
Okay.
With the because we had gotten a new guy in town and we had put a bunch of hours into it and then all of a sudden he ended up closing up anyway and um yeah, I mean if Amy feels comfortable with what we have, which obviously we don't have anything technically on the books, but with each individual person having to be licensed, if she feels comfortable with that, then that's fine.
Yeah, I'm okay with that. As long as it's okay with other members, I'm okay with it.
Okay.
So that was all I had in unfinished business.
Okay. I guess we had talked about like fourth, um, we were going to put in some type of reinspection fees and so forth, right?
We had approved the reinspection policy, I believe in the last meeting. I think that was what was in the minutes.
Okay.
So that is up on our website and is available to any of the food service establishments that need it and is included on the revenue report as a food service reinspection. So you can see um, we did have one already this fiscal year in August.
Okay.
And we didn't run into any problems with that particular establishment based on our, policy that we had put into place.
Okay. All right, then go ahead. Keep on going.
So we're up to new business F.
Mhm.
And so that would be our fee schedule changes. So included in your packets was a proposed fee schedule change that I put together. So there was three fee changes that I was looking to get approved. And I compared us to our neighboring municipalities, just so that everyone knows Aspetuck Health District is Easton, Weston, and Westport. They changed their name recently to Aspetuck. So just so you know that that's Westport, Weston, and Easton. So for a water treatment wastewater discharge system permit, I would be looking for a fee of $50. And what that is if you have well water, a lot of times you need to treat your well water because of a variety of different things that are coming out of it. And those systems often have to be backwashed. And that backwash is not something we want going into a septic system because it's just an unnecessary amount of water being added to a septic system that's already dealing with a lot of different water and sewage. So what this fee would be a permit to put in a separate type of system for just that well water treatment facilities discharge.
Okay.
So
Is
I
that
was
something
proposing.
you've run into
We don't run into it a lot. We've had 2 so far since I've been here in December. But it
Oh,
is something
okay.
that is in our septic code, and has a section dedicated to it in the septic code, and is something that we really would like to encourage residents to do, to separate your well treatment from your septic so that you're not inundating your systems. So it's something that I would like to be able to start keeping track of. We do in the septic code have to kind of look at the plans and do kind of a soil test inspection kind of thing with it. So it would be nice to have a fee associated with it so that we can cover some of our time with that.
Okay.
So that one, most towns around us had about a $50 charge. So that's kind of what I was proposing, was 50, because it seemed kind of in line with everybody else.
Okay.
So the next one next to that is a subdivision plan review fee. So this is part of a septic project. So for example, if you have a large parcel, say like 20 acres, and you're going to subdivide that out, the way our fee schedule works right now, you would just have to pay a flat $175, even though we would be looking at up to 10 to 15 different lots with different systems and well locations on those. So it's a lot of extra work. So I was looking for a way that we could kind of help defray some of our time with some cost. So I was proposing $175, which is our current plan review fee, plus 25 for each additional lot. So if you had a lot and you were looking to just subdivide it, you would pay $200.
Okay.
But
So
for those
why,
larger lots, it would bring in some additional revenue.
the question I would have would be, um, if we're getting 175 for a lot, why would we only charge 25 per additional lot? Why wouldn't we charge a higher amount? Not necessarily a full boat, but why wouldn't we charge more than that?
We could, but a lot of times they end up becoming a little bit more cookie cutter because of the way that the soils are done or the septics are done with the subdivision. So it's not necessarily, a full review.
Okay.
There are other towns that do it like this, where they do it like a base fee, and then per lot you get an additional fee. Naugatuck doesn't charge by the lot; they just charged a straight $210.
Mm-hmm.
And then Reading and Aspetuck didn't charge anything at all.
Trumbull has septic, right? So they don't, I mean,
Trumbull does have septic, and they do about $25, but they call it per condo unit. So they're a little bit different, but they do it per unit as well. So they're about $25.
so if a lot has, say, 10 plots, so they make 250, how much do we make?
We would make, the fee would be $400.
Got deter any? I don't think so, because these are commercial properties. An additional $150 would not deter them to go to Trumbull, right?
No, for
Yeah.
the most part, it's not going to be a deterrent,
Yeah.
because they're going to end up paying, once the lots get subdivided, you end up paying per lot anyway for everything. It's just like we did one the other day, and we spent 3 hours out soil testing, and then we have to go out again and do more soil testing. And then when the plan comes in, now I'm looking at 10 to 13 lots for septics, reserves, and well locations. So for them to just pay $175 didn't seem quite right to me. But again, I didn't feel super comfortable charging them $175 per however many lots, because they're going to end up coming in again anyway when the houses are actually proposed.
Okay.
Fine by me.
All right.
I'm okay with that. Yeah.
Yeah, I mean, it certainly makes sense to me.
All right. And then the last fee I was proposing was something that we've already actually put into existence, but I'd like it incorporated into the fee schedule. And that's the $5 charge we're charging to send the ticks up to the state ag station. And that helps to defer the mailing costs. And we also identify the ticks when they come in and do some education with the residents when they're bringing the ticks in, to talk to them a little bit about Lyme disease, tick removal, and tick safety.
Okay.
Yeah, man.
The numbers that we see here certainly seem in line to me. Um, in the overall fee schedule, were there other things that you wanted to change up, down, or what have you, out of anything that we do have, listed in the fee schedule?
So I did do some more comparisons on some other items within the fee schedule. I think I looked at itinerant vendors. I think I looked at temps and farmers markets, but we were in line pretty closely with our neighboring town. So I definitely didn't feel comfortable raising the prices or the
Okay.
fees at all.
All
So
right.
I have those numbers if you're interested, but there was nothing there that made me feel comfortable enough to raise them.
No, and obviously we don't want to if as long as we're, pretty close to in line with everybody else. Um, and we're not overly high on anything else either, are we? That
No,
you saw?
we were right in line with most of them.
Okay.
We're always going to be a little higher than some of the others, like Reading. We're going to tend to be higher than Reading and Bethel. But we're lower than, Trumbull or Newtown, because Newtown actually just raised their fees recently, and we're definitely a whole lot lower than Aspetuck and Fairfield.
Okay. Oh, lost lax.
We lost.
Okay. Lost lax. Oh,
Nope,
now
we
he's
got
back.
Lex back.
Okay. Um,
So I don't know if we need to vote on this. I already
well,
ran them by Ken as well, so he was okay with it. So the next step after the Board of Health approves it would be to put it in front of council.
that would be correct. So I am definitely in favor of the proposed new schedule fees as written on the sheet that Amy has sent out, um, as she has written it there.
I will second the proposed fee schedule changes as well.
Okay. Um,
I'm in
and
favor.
excellent. And Amy, I'm assuming you're in favor, seeing as though
I
you were
am.
the one that wrote all this stuff.
Yes, please.
Okay. All right. So that motion carries unanimously. Please go ahead and forward that to Ken so he can, present to council
Okay,
the
perfect.
proposed fee schedules.
All right. And so the last thing in new business was a grant update, just to kind of give everyone an idea of where we are. We
Mm-hmm.
applied for a preventative health block grant, which is now a competitive grant from the state of Connecticut, back in May, but we did not get it. So that was kind of a bummer, but not wholly unexpected. We did get another grant that's coming in November called the Workforce Development Grant. It's part of the CDC initiative to, I'm trying to think the best way to say this, to prevent burnout of the public health workforce and to get more public health workforce after COVID. So there's some money coming in for that. We still always have our annual prevent public health emergency preparedness grant. So we have a part-time public health emergency preparedness coordinator that works under that about 5 hours a week. And then we are still working with our ELC2, which is our COVID grant, which will end in May, and that is funding the salary for our health educator right now. So that's where we are in grant world.
So you were able to find and hire a public health educator?
I did, yes. She is from Fairfield University. She just graduated in May. She's from Prospect, so she's from the area, and she is doing great. So she's already working on some of our Facebook posts. She's working with our public health nurse on the vaccination of the children and, getting that program back up and running. She's working with all the flu clinic we're doing with the senior center. And then she worked with the COVID test kits and things like that too.
And how many hours a week is this person?
She's full time. She's 35 hours a week, completely funded through the grant.
Oh, excellent.
Mhm.
Okay. So how many people are actually working for our department now?
So full time we have 1, 2, 3, 4, and part time we have 2. 3, no, 2. Hold on. Part time is kind of 3.
So
We
it's
have
obviously
3.
you and Barbara.
Yep, Barbara and I and Samantha, the sanitarian. And then
Okay.
Kelsey, the health educator. And then part-time, we have Mike Allen, who's our emergency preparedness person, 5 hours a week. We have Bernie Bova, who's our public health nurse at 8 hours a week. And then we have Laurel Shaw from Newtown,
Mhm.
who's kind of still on call for septic help as we need it for things that she had worked on when she was here.
Okay.
So
All right, good. All right, well, we moved all through all that stuff pretty quickly.
I talk fast.
Okay. Does anybody have anything that they want to talk about, need to talk about? Uh, anything further about anything we've already talked about that you want to discuss any further?
Nothing related to this topic, but I have a question.
Sure.
With regards to the vaccinations, right?
Mhm.
I mean, just FYI, I'm a pharmacist, so I'm always looking for to do different things, different ways. So if we have an elderly person or a disabled person, and for them to get the new set of the COVID vaccines and or the flu vaccine, do we have any kind of an action plan, or they are on their own?
We don't have anything currently. COVID is no longer covered from the federal government for the
Yeah,
vaccination, and the
yep,
flu never has been. Monroe, because we're so small, we don't have the resources to buy the vaccine to give it out, because we can't bill insurances for it. So it would just
yep,
be a total loss. So for homebounds, there's different, Bridgeport Hospital has like a geriatric homebound program. Sometimes the visiting nurses will do it. So we don't have anything in place. COVID vaccinations for the new boosters are really up in the air still, since they were just approved. So I'm thinking most people are going to be going to their pharmacies for those because none of the local health departments can pay that price for those shots.
I know, yeah, it's like, man, even we buy it for $110.
Yeah, it's
It's
over
all
$100. It's crazy.
okay. The reason why I'm asking is I was trying to reach out to somebody to see if they are interested for a private pharmacy to do it, and I don't know if this town has any kind of like how would I say it the right way? If they have some guidelines to how to do it, or they don't want to be involved, because I know a few of independent pharmacies who are interested in doing that just to
Yeah,
get the name.
the homebounds only really started as a health department function during COVID. Before COVID, the health departments did not get involved with homebound flu vaccinations.
Yeah.
So I'm not sure the best way to do it now.
Okay. All right, that's fine. All right, I appreciate that. Thank you.
Sure.
Anything else from you, Mike?
No.
Is there anything else you guys would want to hear about or talk about at the meetings that I'm not including?
No, you cover the main stuff, which is all, we want to know, kind of the status of stuff, and you go over, where we're doing well and where we're lacking. I think it's all fine to me. I guess it's just fortunate right at the moment we don't have a lot to talk about. So I guess at this point, if we have nothing else further to discuss, I will go ahead and motion to end the meeting.
Oh, wait, before you end it, sorry.
Sure.
The October meeting, I just wanted to, Chris and I had talked about it. We're going to cancel that one because I'm away that week.
Yep.
So Barbara will send out a formal cancellation notice, but just because everybody's on so that you all know.
Yeah, so we'll at this point, we'll all meet again in November. We will at that point probably start at least as a preliminary thing to look at budgetary things, because that will be our December meeting that we have to vote on anything new in the budget. So if there are things that you feel are important that needs to be changed, Amy, please, by all means, make up some kind of dialogue for us to talk about and figure out kind of thing. So we can, help you, help us kind of thing.
Okay, perfect.
Okay. Okay, anything else?
Nope, I promise.
We'll have a new
All right,
selectman then,
excellent.
right?
Okay.
When's the vote?
All right, so motion to adjourn.
I'll second it.
Okay, excellent. Lax, you're okay?
I'm okay. I'm in favor.
All right. All right. Thank you, everybody. You have a great evening. Is there anything else you need from me, Amy?
Nope, I'm all set. Thank you.